an Arkansas stone, and it's a little bit different than, these guys have a flat stone, which is just like this.
Mm-hmm.
And both are totally appropriate. So this is a flat stone. And then the Arkansas stone is kind of has more, I just do it and it has one side is actually curved. And you can see that this is, like the curve here is bigger than the curve. Or it's a higher angle curve up here.
Is that sort of like where this one
Yeah.
tried to modify?
So,
okay.
So I love the fact that you have these because I always try to
Yeah.
describe them to people and I can't. So this is a conical stone, and I break these all the time. And Jolynn has proven to us that they're just so fragile. And what's nice is instead of having two separate stones, if you get an Arkansas stone, it's basically just one that you can use. So what you're going to do is this is our elevator. It's a wingtip elevator. These are the types of elevators that I really like to use in general for dentistry. The luxators are the ones that don't have the wingtip and kind of are longer. Sometimes for cat extractions, I may use a luxator. I pretty much don't use them in dogs because I feel like you can just get a lot more torque, and it's so much easier to break teeth with luxators. So I mean, you can break teeth easily with anything, but I think that it's easier not to break teeth using the wingtips. And I really like the short handle ones, which are, I feel like all the hospitals that haven't gotten new equipment like have all the long ones. I don't know if they only had long ones back when we purchased them, but the long ones, it's just harder to, like the short handle ones really just kind of sit in your palm, especially if you have like smaller hands. It's just a lot easier to use. So what you're trying to do is you want to sharpen the whole back edge. And so, and I always tell people that what you're trying to do is you're trying to create the mouth of a happy face. So,
What's that?
so basically I'm going to take this, the oil, that I make my happy face. And then if you guys want to come in closer, you're welcome to. So what I'm trying to do is I'm sharpening the back edge. And so when I'm on the right side, I'm actually sharpening the left side. And when I'm on the left side, I'm sharpening the right side. And I want to hold it at like a 45-degree angle. And I apologize for the noise. So I'm going to go like this. And as I go to the right side now, I'm sharpening the left side. And as I go to the left side, I'm now sharpening the right side. And I would do this like 10 to 20 times. So I basically, and I'm just kind of swiveling the elevator in my hand as I'm doing it. And it's like, everyone always says how much force to use, and I guess I would say moderate. I don't know what that means. So now I basically just sharpen the whole back edge. What it ends up doing is it causes some imperfections on the front. So the purpose of the conical is now I just go to the front and I just do one quick, and that's it. And so the elevators, I'm just going to do 10 to 20 times. Over time, you'll see that your stones will actually have that happy face mouth. In the last lab, I was watching one of the vets and one of our mentees, and she was going the other way, and I was like, no, that's a sad face. It's like, I know it's probably a reflection of how all of us are feeling right now. And then, so I sharpen those, and then, so this is the gingival elevator, so this is what you're going to use to lift the gingiva, and there's a couple different types of these. So these are flat, which you can end up sharpening these in two different ways. So I think if you go into WFU, there's a whole bunch of dental CE in there. I think Dr. Huff does it, who's one of VCA veterinary dentist. And I feel like he did his the same way, where he would go like this. So he's sharpening, on the left side, sharpening the right side, and then on the right side, sharpening the left side. Dr. Levine, actually, when he does his, he actually does it straight. And I think both ways are appropriate. So I usually do this straight. And so what I'll do is, again, 45-degree angle. I'll do that, 10 times. And then I will just turn it a little bit. So now I'm getting the right edge. and do that like 10 times, and then I turn it a little bit so I'm getting the left edge. I do that like 10 times. And then for the front, I just go one straight, one on that angle, and one on that angle. And then, so now that instrument is sharpened, I can do the other side as well. Now, a lot of hospitals have curved gingival elevators. I think I have one here.
So we have one in the rainbow pack. Yeah, we have one in the rainbow pack that's curved. And then we also have one that looks like a flathead screwdriver.
Okay. So this is a curved gingival elevator. So
It's not that
different
curved, but it's
docs
curved.
have different preferences. I like the straight ones because I always have trouble kind of getting over that ridge where the tooth meets the periosteal bone. And I feel like it's tougher with these, but I tend to jab my gingival elevator right through the gingiva, and this helps prevent that. So I think that's why these sometimes people prefer. So if you're doing this, you have to realize that your edge now is on a different angle. And so you're doing this exactly the same way, but instead of, if you're at 45 degrees, you're really not sharpening that bottom. So you actually have to be at like 60 or 70 degrees. So you're just gonna be, if you have a curved one, you're just gonna be at a higher angle. And this is something that the docs could do the sharpening, you can train your techs to do the sharpening. So, any of us, could be something that any of us is doing. So I'm gonna have you guys now practice some sharpening. So
You can grab our stone and our oil.
So I have two of you guys I can set up over here, and then the other
Nope,
two
I
over
pulled it
here.
out from the plastic bag.
And then we can also have you guys maybe practice over here, and you can just grab.
There's
know,
one
any of
actually
the,
behind us if you want to grab that.
You can
pack.
grab any of the elevators.
That's
there.
not auto-clamped yet.
You can grab any of the elevators to practice with. So I have stones for you.
Yes. I looked it up. Yeah, so it definitely makes sure
One tip when you're done,
to try those while he's here. Yeah,
the
but we
oil
can
makes
also
a
look
bit
at
of a
these.
mess. And so I just really try to clean it with like a paper towel when you're done, because if you put it back in plastic, the next time you go to take it out, it's like a gooey mess.
You don't wash it with anything? Like you don't rub it underwater?
You could, but I usually just clean it with stuff. Supposedly they make ceramic stones that you don't need oil, but I don't think they're veterinary specific. They might be more for cooking or something. But I was looking at ordering for ceramic stones and I couldn't find any.
Does the oil come with the stones when you buy it, or you have to
No,
know the name?
We bought this honing solution.
It's up here.
One for each.
No, for
Yeah,
each
we
person.
can just go.
So the oil, when I order it, I would just,
Sorry,
I would just
people
go
who
onto
are
order
watching.
it, and I would just put in like stone sharpened oil. And
That, yeah, so those are very, very old, but that's okay. Yep, that's fine. I'm gonna put this stuff under.
These are the luxators.
Those ones you guys
We
use.
hardly
Yeah.
ever use these, yeah. These are the ones that we,
But yeah, these are luxators as well that are in here.
okay,
In the
right.
purple pack.
Which are fine. I mean,
Yeah.
I'll, sometimes what happens is if I get above a 4 in here, I'll go to.
But I
a
think
bigger
these
one
have
like
been
that.
improperly
I
sharpened
agree.
for years.
I agree. So they're getting,
So they're-
I mean, look how ancient these are.
They're delicate flowers. We'll just make sure that he goes through with us these ones. So here's the one that looks like a flathead screwdriver, to make sure that we're sharpening these extra super delicate
This
fronts.
is the curved that he
Yes.
was talking about.
It's not as
okay.
curved
It's
as
not
these.
as flat. These are also going to be very slightly curved. Okay.
A lot more curved than
But
this
again, these
spatula.
were abused and sharp. Well, for a lot of these nicks are from the drill. Okay, but anyway, I think a lot of the sharpening wasn't really done as well as it could have.
We didn't really have much education.
Exactly, so we were just kind of going off
Winging
of
it.
yeah. All right.
Who wants to go first? Here is our oil.
Can you put it on that one?
Yes, or yes. This is what the cone looks like before Joanne broke it. There is one on order, and then we used to have this clear thing to test it, but I don't think we need to do that anymore.
Should we just order the Arkansas one?
I asked Bert to order this. It's okay. Just do your best. Yeah, it is what it
Smiley,
is. You know what your smiley face looks like. I asked Bert to order this one before I knew his, so I mean, if it's relatively inexpensive.
I also want to know what the price point is for the sharpening, the professional sharpening. Figured. But
Okay.
if we do it every 6 months,
I know we have our, so here's a winged, where's the other wings? There's wings,
is
here's a
wing.
wing.
This is wing.
Some of the short fat ones are. I
That
inventoried
one's
them.
skinny wing,
a couple.
and that one's
Right, left.
Exactly.
Yep.
Well, this one actually has wings too.
You want to be on a 45-degree angle,
Oh, yeah.
and you're making that happy face.
Happy face it up.
Perfect.
Can you go through with us at some point these super delicate ones, because I don't want to hurt them?
You mean as far as how to do it?
Sharpening, yes
Yeah.
please.
It's a little weird
Sorry,
at
I'm
first.
recording that. You're doing a
No,
great
you're
job.
okay.
It's wonderful and exciting. And I'm gonna upload this on YouTube, so you guys have access
Harder
to
than
it.
These are
Yep, and you
kinda
don't have
cool.
to, look how you pushing a little bit too hard. See how your knuckles going a little white? You don't have to push that hard.
45-degree angle.
And I think it might be easier to hold it like, kind of like that, rather than like that. So you're almost like sit it in your palm,
Okay.
and then exactly.
Yeah.
Wish
It's kind of weird, yeah.
For the oil thing, it's just a smaller bottle with a nozzle.
We've got
Yeah.
the dropper
Okay.
things that we use the
Okay.
eye solution in. We can throw
Okay.
some in there. NBD.
Did you want to take a picture of this?
Is this wrong? Because this is what Dental Rich Conley told us. Well, he actually bought it for us and brought it over.
I'm sure it's fine.
Okay, Mazel
Yeah,
tov.
yeah, yeah.
We have
Yeah,
a
it says
crap
for
ton of
sharpening
this.
stuff.
Yeah.
I'm sure it's the same stuff.
Yeah, best friend Rich
And then,
Conley to Miss
should we do the,
Miss.
And then you
Miss
do it on the
very much.
round. And you
He
do
was
it,
so happy.
right?
should I do it on this?
Yes, but you gotta. I would just go beep. There you go.
And then you just.
And then just whoop,
Once.
and then be done.
Okay.
Mazel tov.
Interesting.
I just want to see the difference between like
Yeah.
a similar one, you know, just to see.
You're not gonna see that much different. It's like when you take your knife and go
Okay.
back and forth, or you see those chef people going back and
Yeah.
forth. You're just making the edge pretty, so it slices better. It's not going to be a big difference between
Okay.
what it looks like unsharpened, but the doctors will feel it. I know Dr.
Yeah.
Lee had been asking me for a while to do it, and I apologized to her that I didn't have much time, but
Yeah.
we did sharpen it, and then immediately she noted a big difference.
Yeah.
Okay. Should we try this one as well?
If you
The
would like
straight
to,
one?
absolutely.
Is that the straight or do we curve that one too?
That one isn't as curved as his, so I think you can do your happy face.
Do the happy face? Yeah.
Yes, beautiful. Happy face, happy face, happy face. It's a
I know,
beautiful
that sounds
noise. It's wonderful.
horrendous.
The doctors appreciate your hearing. And you can see our stone, we had such a straight line, we were definitely not doing it appropriately, but we are following another video, so we'll just do what best friend Dr. Jason Berkowitz tells us to do.
Think about which side I'm starting.
And you can, if you want to do the, are you doing the same side as Ernessa?
Yeah.
You can do
Just
the
get
other side,
Do I do?
because there's two sides, you can just do
Oh,
that. Yeah.
I see what you're doing. Yeah.
Beautiful. It's gorgeous. Lovely.
And then do we do
He
that's
said
all we
just
did for
one
the-
scrape.
on this part?
Yeah. To do the to do the top.
Oh,
That's all
interesting.
he does. And then this old Dr. Towel wrapper is in the drawer too if you wanna. I try to usually do it on there because otherwise I make a mess, and sometimes I wear gloves because
Yeah, it gets gross.
it'll gross.
So I kind of imagined that we were gonna smooth all that out.
Nope.
Okay.
Like she said, a lot of the times the
from the
doctors,
drill.
hold the gingiva up with that so they're not ruining their
Yeah.
flapper.
Interesting.
Let's see if we can get Dr. Jason Berkowitz over to help us. So, I mean, look at this one. It's supposed to look like this.
Oh wow.
So this one has been beat up quite a bit.
Yeah, that's crazy.
This one also is one of the Luxator type, and this one as well. This one got dropped a couple of times, so it's bent, but at least that one has a divot to grab your root, and this one does not.
So, like, should we order a new one, or is there a way to kind of make the groove again?
I don't think they use it enough
Oh, okay.
to want another one at this point. They might want more of these kind. This one got dropped on its head at some point too. The tip of it is curved, not as bad as that one is. But it slips out of your hand when you're
I mean,
got
it's- yeah.
dental stuff on it.
Understandable.
Are those the two nudes, the two mentees? The two mentees are together and then our people are together. Mazel tov. Sharing is caring.
They're what? What are they?
Those are two doctors from another clinic.
Oh, doctors. Okay. I thought you
Yes,
said
but
something.
they're mentees too, so
Oh,
like,
okay.
like they're new doctors
Gotcha.
going
No,
through
I
the
just
program.
misheard you.
It's okay. Sometimes I don't speak English. That distiller looks very good though. Thank you for cleaning it.
Yeah.
It's beautiful.
It took a while. It like took forever.
That's good though.
Really built it.
Marco, he's in the room. I don't know how to pause this. So we only have 2 of those technically. There are probably more in our packs like those purple ones are.
Yeah, there's one in the orange pack. It's not the orange and blue pack.
If ingested, drink lots of water. I love that.
Good warnings.
Yeah,
Thank you.
It's easy.
All right, sorry people watching this later. I'm gonna walk and it might make you dizzy, my bad.
I think it's good to have, but.
Can you show us the delicate ones real quick?
Yeah.
Sorry, thank you.
I'm so sorry. No, it's okay.
Sorry again, we're walking.
So with these, what I would do is, basically I'm doing it similarly to one of the other gingival elevators, that I would just go like, I'm looking at not the angle of this, but the angle right here. And so I would just do that like 10 times, and then I would kind of, now I'm trying to get the right back corner. And then I probably, to get the left back corner, that's a little bit trickier, I kind of have to go like that. And then
The flathead
for
screwdriver.
this one, again, I would do the same thing, like that 45-degree angle. But see how that has 2 sides? I probably then would flip it
Flip it
over
over and do the other side.
and just do the other side. But one thing to keep in mind is when you're doing one side, you're causing an imperfection on the opposite side. And so the very last thing I would do is
Flip it
on the
back
opposite
over.
side and just make one there.
Okay.
And then this one, I'd kind of do the same way. So I'm always trying to sharpen the back edge. So I'd hold it on like a 45-degree angle. And because this is flat, you only need to do this. You don't need to, the curved ones are the ones that you need to kind of do the angling. But with this, I would just go like that.
Okay.
And then I would finish it off, but it's tough with this one because the angle matches.
Thank you.
Easy.
All right.